Hi there. If you're anything like me, you would love a clearer picture for what's really going on inside your body. And by that, I mean something beyond just a typical blood draw or even like your yearly check in with your PCP, or something where you're expected to come in with the questions that you want answered, or otherwise they're just kind of checking boxes. Um, you would like a better sense of control over your body and your health. These are the sorts of notions that drew me to something like LifeForce. I am a 34-year-old dad. I am a father of two kids under six who are honestly running me a bit ragged. My hair is starting to recede and thin out. My energy levels are practically non-existent. My focus might be even worse than that. So I've had these issues and concerns kind of creeping in on the periphery of my life over the past few years. And I'm nearing my mid 30s, and I've decided I want a better sense of control and just a clearer picture. Like I said, a peek under the hood of what's going on in my body. Where do I sit health wise, truly? And come at that from a totally from scratch. Like, I have no idea what I'm doing. I just want a check-in, and I need someone to guide me through the process of what to do and what to improve upon and what changes I need to make in my life so I can be there for my kids and will cut short that time I have with them. I was also very interested in my hormone levels. I had done some research into testosterone levels specifically, and how low T levels can contribute to the brain fog that I have been feeling, or feelings of fatigue, this sort of thing. So I had suspected maybe my testosterone levels were low. And so that's really what led this journey towards me discovering LifeForce. And I wanted to put this video together and review the platform because it's been a very positive experience thus far. First of all, I get very googly eyed when it comes to anything medical related at all. So doctors' offices, hospitals, these sorts of things really intimidate me. And even if I plan and come in with questions, by the time I'm sitting down, my doctor has asked them to me, they're out of my brain. So I needed something like LifeForce to act as that sort of pioneer, that guide for me to say, okay, here are the things we're going to measure. We'll wait for your results, and based off of those results, we'll do XYZ actions. If that sounds appealing to you, you are going to love this sort of service. I also really appreciated, and the reason I brought up the fact that I get googly eyed and any information I come in with is lost, I appreciate how streamlined and how catered this is towards people like me. Who need some sort of guide. Like, even the website itself and how they break down how this works is very, very clear. It's step 1, step 2, step 3, step 4. And it breaks something that can be intimidating for folks, truly, or just foreign, or sometimes almost like another language, into something that's very layman's terms and actionable for you, and really can make a difference for you. So, from the get-go, you're going to start your membership. You'll sign up. And the first step is to schedule a blood draw. So you'll get your baseline markers. Signing up to the platform itself was very easy. It's just like going to the doctor's office and filling out that initial healthcare history questionnaire, right? It took me 10 minutes all told, but it might take you a bit less or a bit longer depending on your history, right? But that was very easy. Getting in the system was very easy. And then from there, you can schedule your blood draw. They offer two options, which I was really impressed with. They can schedule a phlebotomist to come to your house in home and do the blood draw in your home from the comfort of your couch, which was great. Some locations differ, so availability is going to be different based on where you live. So I live in a place where that was not an option. Unfortunately, I definitely would have seized that opportunity. So I just scheduled an appointment with Quest Labs nearby, which was totally fine. This process was seamless. I was able to schedule, honestly, for the next upcoming week. So it was a very quick turnaround. I had signed up over Friday, and by Tuesday I was in and drawing my blood. So that was great. I will say it's quite a bit of blood. Like, there's a lot of markers they want to measure, and they want to get a true, accurate baseline for a bunch of things, from testosterone to cholesterol, and everything in between. So it was several vials of blood. You could probably tell I'm not a medical person, but I don't do well with blood draws. So that was a little bit intimidating, and I was a little nervous going into it. But I would just encourage anyone who's like me to just be communicative, whether it's a phlebotomist at your house or you're going to a lab elsewhere. let them know if you don't do well with blood draws, they'll recline you back and get a fan and pamper you like they did me, and it's totally fine. And you just look away and find your happy place for 10 minutes, and it's all done. But so that's step one. You get your labs done. Their turnaround time on that was about a week for me, which I felt was not too bad, honestly. There's a lot of things they're measuring. They also have to ship your blood out to the lab and get that measured. So you'll have about a week downtime before your results come in, and then you'll get an email when they do come in, and you'll find your results on your profile on your dashboard. And what's interesting and what I loved again about how simple LifeForce makes this is they condense everything down to an overarching score, right? So you have a score out of 100 based on their certain measurements, right? Certain markers that they have. And so right off the bat, that's very layman's terms. Like how much simpler can you get than a score out of 100 for where you're at with your health? They also boil it down into your estimated biological age. So I am 34, but my biological age is 19, which is maybe is my mental age as well. Who knows? But I really appreciated just the condensed and concise nature of taking these very complicated measurements and these numbers and scores. You'll find in a second when I show off my lab results, and condensing it down into, okay, here's where we estimate you stand on a 0 to 100 scale. So that was great. The dashboard itself looks like this. You can go in and view your results. You can also find your results on your dashboard under the results tab, and you'll have subsequent tests. You'll retest every 3 months or so, and they'll just be logged over time here, and you can see your improvements over time. At the time of this recording and this writing, I've not done my retests. So I've gone through the process of getting my labs, meeting with the clinician, and meeting with the health coach. And from there, we'll see progress. I've already noticed progress. But let me show off my results real quick. The dashboard itself is really nice. So once you get that one step more complicated and you start showing off the actual results of the biomarkers, I really appreciated the explanations beneath each. So they explain, first of all, what it is they're measuring, what it can affect, whether it's too high or too low, this sort of thing. And it's also very clearly classified. So you can sort by your markers that were in the optimal range, were outside of the optimal range. You can filter by the types of biomarkers. So if you were like me and very interested in your hormone levels, you could filter it down in there. You can see my testosterone was, in fact, a little low, as was DHEA. And it also showed that my cholesterol was a tad bit high. Nothing too concerning, but something worth talking to the health coach about. So that's the dashboard and the lab results. Again, by this time, we're about a week and a half, 2 weeks into the process. From there, a clinician will reach out to you and you will schedule a call with them, a Zoom call. And it's about 30 to 45 minutes. And you'll connect and they'll review line by line what their interpretation of your labs was. And that was where I felt really the service of LifeForce started to shine, because it was at that point that I was truly being guided by someone who knew this world, knew this language, and knew truly what my numbers meant. So for example, I got my LDL back. I was a little concerned. I have cholesterol issues. They were able to talk me off a cliff a little bit. Yes, I was a little bit high on the higher range. This is still, in her opinion, within a normal range and something that we can bring down simply with diet, and nothing truly to be very, very overly concerned about. So sometimes these red labels can be a little bit alarming, and meeting with a professional can help guide you through that process and really focus your attention on what to do, what not to do. Her biggest improvement, honestly, was the thing that kind of was a red flag to me the least. That's an awkward way to say that, but my vitamin D was low, and I explained to her that I work from home all the time, actually like in a basement. So I'm also in Maine, so I spend a lot of time indoors and don't get enough sunlight, honestly. So her biggest recommendation was to get on a vitamin D supplement, vitamin K supplement as well as some omega-3, and start to influence these other things by lifestyle changes. So that was great. The actual meeting itself took 30, 45 minutes, and I felt really connected with her. It was very much a personalized human experience, And if there was one word I would describe LifeForce as, it's very human and personalized. It did not feel like what I always feel leaving my healthcare providers, my PCPs, is I didn't feel like a check. I didn't feel like a clipboard. I didn't feel like a form on a clipboard and someone was going through their standardized questions or list of questions. I felt like someone was tailoring their questions and the Zoom call itself to me and my concerns. And where that was even ratcheted up a notch was in the subsequent health coaching call. So from the clinician call, she recommended a health coach consultation. And that is something that is provided alongside your membership and is ongoing. So I scheduled a call with this health coach. We connected immediately. She came up with on the spot tons of recommendations, especially from a diet and honestly scheduling point of view, how I can go outside and get some more sunlight, and even physical activity suggestions and just ways to optimize my life. She really asked me personal questions about what I wanted to get out of life, what sort of things I was noticing, and why I was brought and curious about LifeForce in general in the first place. So even that felt another degree more personalized. She really tailored her recommendations towards what I wanted to accomplish, as well as the lab results, right? So she noticed like the vitamin D deficiency, I should say. And that led to the sunlight conversation, this sort of thing. So very, very impressed with the health coach. And I've already started implementing her suggestions, taking the supplements they provided, and it's already been a noticeable difference. I'm waking up earlier and feeling energized immediately. I don't need that entire pot of coffee anymore. Just simply rearranging my schedule to get outside and run throughout the neighborhood in the morning has led to an insane mood boost and productivity boost. Honestly, when I first sit down, I'm no longer opening up Reddit or social media to get that quick dopamine hit and then getting on with my day. I am ready to rock right at the start of the day. So it's been a really, really positive experience. And I would recommend this for anyone who, again, is like me and needs a little bit of guidance or is a little bit unsure about the medical field in general, but knows they want a better sense of control. They know they want to understand this more. I also really loved how the focus is on longevity, not just in terms of increasing your lifespan, giving you more years of your life, but also in terms of their care plan. Like they're not just here to report on your labs and leave you in the dust, right? Like it truly is ongoing care. It's measurements and progress over time. So my experience will even improve further as I get more labs drawn and I see how my lifestyle changes have affected my vitamin D levels or my cholesterol levels. Were my diet changes enough to bring those down? This sort of thing. How have the supplements helped? So this ongoing sense of progress, and never feeling like you are a checklist or that they've reviewed your biomarkers and given you their initial impressions after reviewing your chart for 20 minutes, and now they're see you next year. It's very structured, and there's a cadence to it, and you never feel like you have been left in the lurch. For example, my health coach, who I really bonded with on the 30 minutes that we had, she gives out her cell phone number to all of her patients, and she encourages everyone. She said, no, like people don't reach out enough. So she's, giving advice routinely through daily text conversations. So it really is, you get people in your corner through this service and people to help guide you towards optimizing your life for whatever it is the outcome is that you're shooting for. As far as pros and cons, I would say there are some cons, right? So first of all, it's a little expensive. There is price. Price is a consideration point. Here are all the I would say consideration points. If you are worried about any of these sorts of things, LifeForce would be a good solution for you. But it is a $150 a month membership, plus costs of Okay, so it is a $150 a month LifeForce membership plus the cost of supplements, but you do get a discount tacked onto that based on your membership level. So that is a thing. That is, I would say, a con. It's a bit expensive. It's money out of your pocket, right? That said, I wouldn't say the American healthcare system is inexpensive either. So this is just you know, part of the deal for trying to optimize and live a healthier life. It costs money, so that is a con. That's unavoidable. I would also say the availability of the phlebotomist was a bit of a concern. I would also say phlebotomist availability was a little bit of a con, so I had to go into the lab. But that said, that's not that big of a deal in the grand scheme of things. And the last con I would have is actually just that almost this is too good. I would be worried about people totally relying on this sort of service, but it's worth pointing out that you can get too invested in the data to the point where you forget it's supposed to be ongoing support and it's not supposed to replace your primary care provider. So those would be the cons, but the pros really do outweigh the cons, in my opinion. It's comprehensive testing. It is so convenient. Everything is very focused on clarity and presenting information from a layman's point of view. You will leave understanding your health to a higher degree than you did before starting LifeForce. Everything is also just very human and personalized and catered to you and your needs. So if you are looking for someone to pioneer your way towards a better understanding of your body, your health, and how you can improve your life, LifeForce is a highly, highly recommended product from me.